Today, I will discuss the early signs and symptoms of cancer and why we should recognize them early and get medical attention as soon as possible. The WHO has signified that there are certain signs and symptoms which can be of cancer. The difficulty is that cancer will not have any specific signs and symptoms which are particularly only because of cancer. They can be a symptom of other diseases, but these are red flag signs. So going with symptoms, the first symptom can be a cough. Cough can be often prolonged, at least 2 to 3 weeks. It can be a nagging cough. Cough can also have sputum having blood. So a blood-stained sputum with cough can be an early sign of lung cancer. This can also be present in other lung diseases like tuberculosis and COPD. However, if anybody has got a cough which has been extending beyond 2 weeks, should be investigated by a chest physician or by oncologist and should undergo evaluation with CT scans or bronchoscopy if required. Next symptom is abnormal bleeding from any site. These abnormal bleedings can be in the form of bleeding in the stools, which is often misdiagnosed as piles and being treated, and this often delays the treatment of colon cancer. So colon cancer will also have bleeding there'll be fresh blood which will come in the stools, and this is often confused by the family physician to be just piles. A simple examination in the form of per-rectal examination can help know whether it is a bleeding from the piles or coming from the colon. Another bleeding can be from in the form of blood in the urine, which is known as hematuria. This can be an early sign and symptom of urinary bladder cancer or kidney cancer. So any urine blood is important and should not be delayed in diagnosis. Next bleeding can be from in the females in the form of postcoital bleeding, which can be a very important sign of cervical cancer. Also in women who are postmenopausal beyond the age of around 60 years and they have resumption of menstrual bleeding can also be a very important symptom of uterine cancer. So these are the common bleedings which can be important early signs and symptoms of these cancers. Next can be unexplained weight loss. So unexplained weight loss more than 10% can be important sign and symptom of GI malignancies like stomach cancer, pancreatic cancer, liver cancers, and some form of lymphomas. Another important signs can be hoarseness of voice. Hoarseness of voice can be an important symptom of voice box or a laryngeal cancer. Apart from this, lumps in the part of body can be important early signs and symptoms of cancer. For example, a painless lump in the breast can be very important early sign and often missed by ladies. So any painless lump happening in a breast, which is usually diagnosed accidentally and often goes unnoticed for some time, can be very early sign which can help us pick up a breast cancer in early stage. Similarly, lump in the testis can be important symptom. Again, a painless lump in the testis can be a symptom of testicular cancer. Apart from these lumps, any other body part having lumps which are increasing in size, initially painless, can be important sign of sarcoma or a lymphoma. Similarly, lymph nodes can also enlarge and be symptoms of lymph node cancers or lymphomas. Unexpected change in the mole size as well as shape and color can be important early sign of skin cancer known as melanoma. So these are the common signs and symptoms which should not be ignored, and if any of these are happening to you, then they can be very important and they should be addressed by going to the specialist and taking adequate test. One more thing which is important is going for oral cancer where there can be early symptoms of white patches, red patches, as well as ulcers in the mouth or in the oral cavity. They are also often ignored by people because they have been using tobacco and for many years they've been using and they've been having ulcers. But any ulcer or growth in the mouth going beyond 2 weeks is definitely a concern and should be addressed by a head and neck surgeon. So I hope this information was useful to you, and if any of these symptoms are there in any of your family members, I would suggest that go to a specialist and take medical attention.